rent the Lambo and go drive it like it's stolen. I've been living wild, I'm just going through the motions. Stumbling out the Uber, grab my hand, gave me the notion. Swimming in your water, but it feels just like the ocean. I can't lie, I've really been addicted to you. All of my attention I've been giving to you. Caught up in my feelings, I got feelings for you. Caught up in my feelings, I got feelings for you. On my mind, I can't lie. On my mind, I can't lie. Pull you down till you dry. Pull you down till you dry. All the time, ease my mind. All the time, ease my mind. I know that you're dangerous, I'm addicted to you. I was sipping Moët for 2 years straight to the face. Champagne belly bubbles still won't go away. Last year my best man hit a stain with bare face. Now he's gotta help me on.
All right, welcome everyone to another episode of This, That, and the Third with Shannon and Hook. We're now streaming live on Facebook, YouTube, and TikTok. And it's 2025, so Happy New Year. Shannon, did you do anything specifically to celebrate New Year?
Yeah, I slept all day yesterday. That's what I did. Yeah. So I went to church, which I was late too, because I didn't know watch night service has changed since COVID. And this was my first time trying to go back to the watch night service. I got there a little late, but then I came home and I slept. I slept till this morning. I was so tired. So that's how I celebrated.
All right, good deal. Well, I was just here with my wife and the kids. Mm-hmm. Just drank some wine. The girls had water and sparkling cider. So played some games. So not a whole lot.
Yeah, I want to do something different this year. I didn't want to party. I didn't want to go to an event. I just wanted to relax and and get in tune with myself. And my body told me I needed to rest. So that's what I did.
All right. And that's actually the perfect segue into tonight's conversation. I know that with everyone, it's 2025, the new year. Everyone has all these ideas, all these different resolutions and things that they want to do, whether it's lose weight, whether it's go to church more, focus on goals. But today we're going to be focusing on prioritizing health in the new year. And we actually have a few guests here who are going to help us along with the conversation. And we're going to go ahead and give them an opportunity to introduce themselves. And Dr. Edwards, we're going to start with you. Tell us a little bit about yourself.
Wonderful. Thanks so much, Hook, for having me. My name is Dr. Nicole Edwards. I'm a board-certified family medicine physician, and I'm also a board-certified obesity medicine physician. I practice integrative medicine, which means I balance holistic care along with traditional healthcare. I opened up my solo practice in 2017 here in Columbia, where I practice what's called direct primary care, meaning I don't take insurance and you just pay a monthly membership fee, and then you can come to me for care. My patients can text me on the phone, we can do virtual visits, or you can come into the office. I do have a practice. It's called Abundant Life Concierge. It's here off of St. Andrews Road, off of 26. And here I do help my patients with whole person health, mind, body, spirit, and finances. Like I said, I help with weight loss, hormone balancing, and learning how to relax and how that helps your overall health. So thanks for having me.
All right, good deal. Thanks for joining. Keisha, we're going to move on to you.
Awesome. Thanks so much, Hook, for having me. I am Keisha Gann. I'm a licensed clinical social worker, licensed independent social worker / clinical practice, licensed in North Carolina, South Carolina, and New York. I am the owner and a psychotherapist at By Design Clinical Coaching and Consulting, PLLC, a solo virtual practice out of Charlotte, North Carolina. I've been in the social work field for more than 20 years, worked in a number of corporate settings, and decided to venture into solo practice early last year and really loving it. Currently working with adults only with a number of emotional and mental health conditions. I practice primarily from a really kind of an eclectic theoretical approach in terms of some cognitive behavioral work, some somatic work, some acceptance work. So a variety of approaches in terms of helping clients not just survive, but also thrive. And so I am delighted to be here, enjoy conversations related to health, physical and mental health. And so thank you again, Hook, for having me here.
All right, awesome. And Kristen, bring us home.
What's up, everybody? Good evening, you guys. So glad to be on and joining in this amazing conversation. I am Kristen Jameson. I am a licensed financial service officer. I'm licensed in South Carolina, New York, Texas, and Virginia. But I can also help people in 49 of the 50 states to help their family with family planning, things of that sort, getting their budgets and things together and understanding how exactly insurance works. I am also do a little singing, singing as well. You guys may have seen me online. I've been kind of viral a couple of times with my video. Most known for being the lady in the blue dress singing at the funeral with the really big hat. That's me. But tonight I have on my professional hat on tonight. So I come on as a financial service officer, helping families save and make sense of money.
All right, good deal. And again, thank you guys so much for joining Shannon and I. And I know there's going to be a lot of great information that we're going to be discussing. So without further ado, man, we'll go ahead and get started. And feel free, once a question is asked, you don't have to be cued to speak or anything. Just say whatever you have to say. And I do want to ask a question of all of you guys, and just to, I guess, get things started. What is the importance of prioritizing health?
I guess I'll start.
Go ahead, Doc.
Yes. So here's what I tell my patients all the time: either get busy living or get busy dying. So
Wow.
If you don't prioritize your health, then you will not have life. My practice, again, is called Abundant Life. And whether you're spiritual with that or not, we have to choose life. It's a choice that we have to choose. And so if we are not prioritizing ourselves and our health, then we are no earthly good for anybody else. A lot of people will say, oh, well, I don't have time for myself. I have to take care of my kids or my spouse or my parents or my job or my this and that and this and that. But without sounding cliche, if you don't put your mask on first, then you're no good, and you don't get the oxygen that you need to take care of everyone else. So you've got to prioritize your health and prioritize yourself. And it's not selfish to take care of yourself.
Yeah, Doc, I think you might need to say that 3 more times. It was 6 people in the back that didn't hear that part.
I counted 10, but I'm gonna let you go with 6.
I like that you use that analogy as far as talking about the airplane and how they tell you to put your mask on first, because I travel a lot. And every time they say that, it's like, it does sound selfish, but but then you also realize, well, if you're not alive, if you're not breathing, you can't help someone else.
Yep.
So yeah, I know, just that resonated with me, because every time I hear that, I'd be like, no, I'm gonna help my kids first, or the person with me. But you really do have to prioritize your own personal health and what you need, so you can feed into others. So I thank you for giving that analogy. That's a great one.
Yeah, I agree with that wholeheartedly. Out of experience, where you're so busy pouring out to everyone else, and everyone is kind of pulling on you. You have nothing left for you to feel yourself. You know what I mean? So it's really great that even to have this conversation so early in the year. Some of us, it takes us a little while to catch up on what we're supposed to be doing, and sometimes it catches us behind the 8 ball. You know what I mean? And we have to do some more extreme measures. Whereas now, today is always a great time to prioritize your health, because as we say, health is wealth. Whether you pay to have good health now with your vitamins and healthy eating and things of that sort, or you're going to be paying for medications and treatments and things of that sort later on. So, where, which way would you rather? I would rather be, the less comfortable way, maybe a little bit in the beginning, but in the end, the work for your good. So.
Yeah, and I would just add on to that. One of the coaches in my fitness community always says, we need to choose our hard, right? So that if we feel like, living a healthy lifestyle is hard, we'll think about what it's like if you're on several medications and you can barely get up, and move your body because you're overweight. That's a hard as well. And so it's important that we choose our hard. And so that resonates with me. And I share it with my clients on a regular basis. I just also like to add in terms of prioritizing health. I often say to clients, our minds are not, our feelings are not separate, right, from our bodies. We are whole beings. And so we have to prioritize our emotional and mental health as well, because it impacts so many other areas of our life, right? And physical health being one of those, but also in terms of enhancing our relationships, right? If we are in good emotional and mental health, we're able to strengthen those personal and professional relationships. We increase our productivity, right? If we are in a healthier state, we get to do more, and accomplish more. Overall, just an improved quality of life. And so we have to, I really, really stress, I'm always thrilled when I see, someone is signed up for an intake, right? It's one more person who is prioritizing their emotional and mental health. But we need more of it. Again, we're whole beings. We've got to take care of our minds and we've got to take care of our bodies. And so, again, I very much welcome platforms such as this one to be able to just say, listen, we get away with things for so long, but as we age, as conditions come upon us, it's like those old habits are not sustainable. So we've got to make a life choice, a change at some point. And we'd rather do that voluntarily, right, than to have something upon us where it's not like now I'm forced to make that change.
Right.
Yeah.
Can I just say this too, real quick, Keisha? I told you guys I'm obesity medicine trained. And one of the things that I do in my weight management or weight loss program, weight is not just about eat less and exercise more. There are multiple tenets of weight management. And one of them is your mental health, your stress, and your sleep. And so for all of my patients, they all get referred to some kind of therapy or to some kind of social worker or therapist, someone, because we have to have our mindset as part of our weight management, because there are so many parts that overlap. And when we're stressed, that's putting out cortisol, which is a stress hormone, which causes belly fat, and it causes stress in our brains and stress in our hearts and stress in our liver and everywhere. So you have to manage your mental health. Is not something separate. Oh, just pray about it. And we don't do that anymore. That's something that needs to be addressed as part of your health overall.
Absolutely.
I'm glad that we're now having that understanding that everything is connected, mind, body, soul, spirit, that we're all we're all connected. And if the one isn't giving and isn't as strong and isn't as healthy, it affects the other areas of of our life. If you're seeing yourself in a declining, if your health is declining and you're seeing yourself kind of go down, of course that's going to affect your mental health. But if you make a turnaround, you change. I was sending someone a message before I had a post today and said, what did you leave in 2024? And the young man responded, I left my old mindset. I said, absolutely, because if you can change your mind, you can change your life.
Absolutely.
And so just changing the way that you look at things, changing the way that you perceive things could really positively or negatively affect your health. And I'm so glad that we're able to make that connection and that they're no longer separate, and it's no longer taboo to talk about your mental health as well as your physical and your spiritual health.
And I like that y'all are bringing up the mental health as part of the weight loss, as part of your physical and your health. Because I always tell my children how powerful the mind is and that everything starts from the mind. One of the things I tell them, and it may sound a little quirky, is that if your brain knows that you need to breathe, but if you tell your brain to hold your breath, it will. That's how powerful your brain is. It will stop you from doing something it needs you to do to survive. But that's how powerful it is. I mean, you have to make sure that you're taking care of it, taking care of how you think, how you speak, what you feed your mind. And that means what you look at, what you read, and also your nutrition. It's also part of that. So bringing up that mental health part, I think, is extremely important when you're talking about prioritizing health. People just think about your body, right? Exercising, but it's also your mind. I like that y'all are touching on that.
And your financial health. That's important too.
Absolutely. Absolutely.
You get a little sad.
How did I forget to say financial health, right?
You get a little sad. Sometimes if the change is kind of strange and the money is kind of funny, you start looking a little. You start looking kind of, some kind of way and feeling some kind of way about it. So definitely your overall health is not just limited to your physical, mental, or health. It's everything about you. Make sure everything concerning you is healthy relationships, healthy finances, healthy.
Oh, you need to say that one again. Healthy relationships.
Yes, it absolutely makes a difference.
Yeah,
absolutely. Because if you hang with a bunch of complainers, that's what you're going to become. You hang around some people who are always positive thinking, then you'll become that if you aren't already. So you want to put that in there about your finances.
And I think that we definitely all agree that prioritizing health is important. Now, we know it's important, but we know that everybody doesn't necessarily do it. So what are, in your I guess, professional experiences or personal, like what are some of the primary barriers that prevent people from making health a priority?
Money. Access. Access themselves. Absolutely.
Yes. People are oftentimes their own barrier.
Yeah.
And then they use money and they use access, I would say, as an excuse. But here's what I learned, that people will find money to do what they want. They'll go spend $800 on usher tickets, but they won't pay me to be their doctor to take care of their health.
Not usher tickets. Don't come for the usher.
I'm just saying, listen, I enjoy usher too, but there comes and I'm not saying that going to the usher concert does not make you feel good mentally, right? But you don't do that, go to the usher concert, and then you can't buy your medicine. What?
Right.
You're right. I ain't gonna say nothing about
or we got our $400 weaves and our $500 nails and our lashes and our brows, but our heart's in failure, our kidneys are right. We're not taking care of our blood pressure. Right. So what, you gonna look casket sharp?
That's right.
Yeah.
That's right. I think sometimes too, it's limited knowledge and misinformation. When people are misinformed, right? And oftentimes it's associated with kind of cultural beliefs or what we've been taught or, what we've seen when it comes to, we go to the doctor when something's wrong, but we don't do regular, right? We don't do regular visits, regular checkups. And so I've come to understand with many of my clients, it's limited knowledge, misinformation can lead people to not prioritizing health, mental and physical health.
I agree.
Now, what do you think? Because we know these barriers exist, right? And I like what Dr. Edwards said is, we make these excuses like, I don't have enough money, or where am I going to find the money? But money, if you want something bad enough, you'll find the funds for it. Absolutely. And I always harken back to my college days, right? Like I would always say, I'm broke, I don't have any money, but I somehow found money to either buy alcohol or go to the club or do whatever, you know what I'm saying? So you can, where there's a will, there's a way. So it's not just prioritizing your health, but making sure that you prioritize those funds as well and allocating them appropriately for the betterment of your health. Now, but with these barriers and obstacles, like what are some of the most effective ways to address those, or do you recommend that people, or even advise people to overcome some of those perceived barriers?
I really am an advocate for, so it's great to hear Dr. Edwards talk about integrative care, particularly when it comes to mental health. I feel like integrating mental health into primary care is such an amazing strategic way, right, to capture individuals coming in with physical issues, physical complaints, but there are also, underlying emotional mental health issues going on that can also be addressed in that space. And so I think more primary care offices integrating mental health care is a way to address the barrier in terms of access. I also think expanding telehealth services, Dr. Edwards talked about that a little bit, the convenience of people being able to be anywhere and log on from their phones or their iPads or whatever to be able to access professional services is absolutely, I believe, integral in addressing the barrier of access to services. And then the only other thing I would say is really kind of what this platform tonight is doing, and it's raising public awareness about how very important it is for us to prioritize our health across the board. And so I believe more opportunities to spread information, accurate information is a great way to address the barrier of individuals not making their health a priority.
I think also starting with teaching your children about placing health as a priority. And I found that kids are very great influencers. So if they put the pressure on mommy and daddy and letting them know what they learned in school about, about health or fruits and vegetables or taking care of themselves, when they go shopping with their parents, they can say, oh, mommy, I learned about this. Well, let's try this. So the more, I also feel like the more that the children are educated and the more that this is introduced into the educational system, that it can also bring a positive influence on the family. That that the family overall begins to make better decisions.
I'm just curious, is health still taught in school like it was back in our, okay.
I know in my daughter's school, it is still, and she comes home and she's like, we talked about the food pyramid. Are we talking about what signs of a stroke? And she's in 3rd grade. So, I'm glad that her school makes that a priority, that they have a garden at the school.
Okay, that's great.
Learn how to grow their own fruits and vegetables and things of that sort. But, I agree wholeheartedly with what Keisha was talking about the access to, telehealth and doctors and things of that sort. So people just, can get better. And the saying goes that we're supposed to do better when we know better.
Mm-hmm.
Absolutely.
Yeah.
I think, like you guys have already said, education is the key. And when we have things like the podcast here, and we're getting out to where the people are, sometimes people don't know where to look for the information. And so they Google. Like they're going to get their help.
Dr. Google.
Dr. Google. I've had people tell me, "Oh, I got my degree from Google.com." Good for you. And when you can write a prescription, you let me know. Okay, but education is key, and bringing it to where the people are, and we're meeting people at their needs. A lot of times, people don't seek. I don't know exactly what the phrase is, but we don't seek wellness until sickness takes over. And so we have to, one of the things of the 7 habits of highly successful or effective people is to begin with the end in mind. And so we have to be proactive. And so we have to start with our education and start with, okay, I'm going to take control of my health before I get sick. I think somebody already said that. And so but again, at their needs, where they're at, bringing it to the people. I go to the schools and do education. I go to the community and do education. I'm on social media and speaking to whoever wants to listen and to learn how to prioritize their health and how to be healthy. You don't have to die when we're 40 anymore, and we're living to be 80 and 90s to live the last 40 years of our life miserable. Do you want to actually, like you said, thrive and be healthy and whole person healthy?
And I'll admit, this topic was so important to me because the the telehealth, the ability to have telehealth was a game changer for me. Because I know that there are things that I will ask about now that before, because I didn't have time to go to the doctor, I would just ignore them. Be like, oh, I got a bump here. I got a something here. I got a pain there. I would just ignore it till it went away because I work full time. I own 3 businesses. I don't have time to go to the doctor. I need that. Telehealth was really a game changer for me. So even if you don't know how to find it, if you get a service like that, it may help you prioritize your health a lot better than having to find and wait for a doctor visit and take off from work and go to a doctor. So that may be a good benefit for others as well.
And there's all kinds of different types of care now. Telehealth is one of them, but now I don't know if any of you have tried to get in their office. We're few and far between. It can sometimes take months to get an appointment with a doctor, but that's why they now have practices like mine called concierge medicine or direct primary care, where we have smaller patient panels and you can get in to see us within 24 to 48 hours, most of the time same day. But you have to know how to find that, and you have to prioritize your own health and sometimes make a financial contribution because you're worth it. So we'll pay that money for the weave and for the Usher concert, but we won't pay it for ourselves.
Yeah.
Sometimes you have to put your money where your mouth is. And so if you want to be better, you have to pay for it. If I want to pay for it, I'm not going to go get it from Temu, although they have them, but I think I'm going to go get mine, a good weave from a good place, right? So if you want good health care, sometimes you have to pay for it. And be willing to make that, it's not a sacrifice. Be willing to make that, what's the word?
Investment.
And get a return on your, right? Financial advisor.
Absolutely.
And Dr. Edwards, I want to ask you a question specifically. Because as a man, most notably a Black man, sometimes getting us to go to the doctor or, do the right thing health-wise is like sometimes like pulling teeth. I got lucky because I married a pharmacist, and because she's in the healthcare field, she when I got ready for obviously, I'm not saying she forced me to go, but she would say, hey,
Yes, she did.
steer me in the right direction, right?
Right.
And like I really didn't know what to ask my PCP, but she would tell me, hey, when you go there, tell them this is happening, tell them you experienced this. If they ask this is what you say. So without her, I pretty much would have been probably lost. Honestly. So how should an individual prepare for a doctor's appointment? Is more than just calling the doctor, hey, I need a checkup and I'm going to come see you. Like, how should one go about making sure that they're prepared for that appointment?
Well, first of all, let's clarify the difference between a wellness appointment and a problem appointment. So everybody knows, okay, I need to go see my doctor for a checkup, like once a year, right? For your annual checkup, for your labs, for, ladies, we need a mammogram. Fellas, you got to get your prostate checked, a colonoscopy. I'm talking for, those of us who are 40 and up. But we know those things. Now, what you should not do to those wellness visits is come with a list of 25 other things, like my head hurts, my toe itches, my elbow, I hit it last week. And 3 months ago, I bumped my knee, because we can't hit all of that at one visit. Okay. So your wellness visit needs to be about wellness things that are going to keep you well and prolong life, looking for things like cancer and things like that, versus having a problem visit where you go and you talk about problems. So first things first, understanding that difference. Secondly, you should have a list of things, at your wellness visit, what happened, what's been going on, what have you done health-wise? Are you eating right? Are you exercising? Are you sleeping? Are you minding your mental health? Those kind of things. But then you might be able to have time for one or two of your biggest problem things. I'll tell you what our biggest pet peeve is. As we're walking out the door, you go, doc, I have one more thing. For guys, that's always something around ED or something, right? For ladies, it's always something. It's always something as we're walking out the door, right?
Yeah.
But you want to have, like I said, know the difference between your problem visit and your wellness visit. And even when it comes for a problem visit, you don't want to have a list of 25 problems. 2 or 3 things tops, because we're not going to remember, and nor are we going to have time to hit all of those problems. Okay. So you need to either have a practice like mine where, you know, my patients, they have my cell phone number. I have my personal cell, and then I have my patient cell where they can text me if their head hurts, or if they hit their elbow, or if their knee itches, you know. So you can have a practice like that, or you can, like I said, 2 or 3 things tops, and those might not all get discussed either, but that's where you need to have a list of things that you want to discuss when you go to the doctor.
Okay, good deal. And Keisha and Kristen, I want to pose a question to you guys. So, like, what recommendations would you provide, like caregivers or family members or friends supporting individuals with either mental health conditions or those who lack insurance coverage for their loved ones?
So I would say in terms of mental health, I think it's important, you know, that family members, caregivers educate themselves on some level, you know they're not expected to be professionals and know all the signs, right? But if you know your loved one and you recognize that something is off, or that, you know, they're not giving attention to their physical, to their appearance or presentation in the way, right, that they normally would. It's important that we not, you know, brush those things off. We need to be able to recognize if there might be something going on, right? And we also need to be able to ask questions, very pointed questions, right? Like, how are you feeling? Is there anything going on specifically with you? Is it, you know, I've noticed a change here, you know, is it something you want to talk about? I think caregivers have to be educated on some level in terms of just basic observation. But they also need to be active listeners without judgment, right? Or you just need to go to church, or you just need to do this so you can get over it, or you just need to, you know, are you praying? That we need to listen without judgment. I think it's also important that, again, we're offering emotional support as caregivers. You're not, again, the professional, but I'm here for you. I know some, you know, I can get you a number to somebody. I can, you know, those simple things can go a really, really long way. I think also encouraging professional help, you know, caregivers can do that. Instead of, you know, again, trying to talk the person out of, you know, their symptoms or what they're experiencing. It's okay. It might benefit you to talk with a therapist. Many of my clients come in and they say, my sister, you know, my mom, like there was a family member who encouraged them over time, like continuously encouraged them to seek out therapy. And when they got to the place of, okay, yeah, I cannot handle this on my own, then they finally reached out and scheduled that appointment. So caregivers, loved ones, friends, you know, people who care and are close can really make a difference in that person determining whether or not they're going to take that step. I think also caregivers can set healthy boundaries, right? In terms of, again, the recognition when you need to seek professional help versus trying to take on people's struggles as your own. You are not, you know, capable, qualified to be in your family member's therapist. And so it's important that those boundaries be in place where you say, you know what, I'm here to provide emotional support to you, but it seems that you have needs that, you know, would be better addressed by your seeing a professional. And so I think, you know, having those healthy boundaries are important. What else would I say?
Those are good.
Yeah, those are probably the top ones that come to mind for me in terms of caregivers and loved ones.
Yeah, that's pretty amazing, Keisha. And even if you're the mental health professional, because sometimes there's somewhat of always one person in the family that seems to be the family manager. You know, the main caregiver for everyone. It's typically the oldest female member of the family, who's typically the family manager, or and even if that happens to be their professional field, to let them know that, you know, that there are resources for them.
Absolutely.
You know, as caregivers. I know particularly a friend of mine, Dr. Macy Smith, who is basically an expert on caregiving for the aging. And basically a guide for those who are caring for those, as well as providing resources for the aging population or the vulnerable population. As far as insurance coverage is concerned, when you're talking about any recommendations to provide to caregivers, family members, or friends, is to be very honest with where they are before you can reach out, as far as knowing what your actual insurance needs are. Because when it comes to insurance, you can get insurance based on many factors. Is it that you're just trying to cover the cost of the service, or is the family wanting to be able to accomplish some things beyond the person's life, or are you covering a particular bill? So we have something which is called like the dime method, where you find out how much your actual insurance need is, whether it's based on your debt, your income replacement, and whether or not you have a mortgage, or education. Do you have children that you plan on educating? And so you kind of calculate what that number is, and you can see what your actual insurance need might be. And it's also, when I say to be very realistic about where you are, and it depends on what your goals are as the type of insurance that you would need to get for your family. And I absolutely say to, as in anything, that you reach out to a professional. Someone with a license. I want to say that one more time. Somebody that actually has a license, that has gone to the board. Not Google, not YouTube University, not TikTok University, or any of those other things that we have access to all of this information, and we're still not retaining anything and still not, getting the right things. But contact a professional. Insurance agent, somebody that may be a trusted person within your family, somebody that's in your community that can have the realistic conversation with you, and also to let them know it's a very hard conversation to have, especially in our community, because there's a stigma when you start talking about life insurance. Oh, you trying to kill me, or you want me to die? No, we just don't want to mourn twice. Once because you're not here, and twice because we can't afford to live without you. And in our industry, we say that, I say to a lot of my clients, like, thank you for, writing this last love letter to your family. This is the last thing that you can give to your family, to let them know how much you love them and you want the best for them, even beyond your present being there. You give them this present with a T, even though your presence with the CE is no longer with us. So my recommendations, of course, would be to reach out to a licensed professional. It would also see if they have any coverage, maybe from their jobs, or maybe someone took out a policy on them like years ago. Their grandmother or their mother, see what they actually have. Get with that professional so they can do a policy review. And as a caregiver, a family member, or friend, when you have that conversation, like, hey, God forbid if something happens to you, what are your wishes? Like, how would you like us to fulfill your wishes? We need to have that conversation so that when that moment comes, that process of grief can be what it needs to be. And you can just solely focus on getting through the grief and not getting through the bills and getting through the planning and getting through all of that, along with the grief part of it. I can say, as in a personal testimony, when my dad passed in March, it wasn't as hard of a process to go through, because my dad was one of my first clients. So I already knew where the policy was. I knew, who to call, what paperwork to put in. Him and my bonus mom, I call her Mama Bear, had those conversations. He made his wishes known. This is how I want it. This is what I want to do, blah, 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 blah. So when it came time to mourn, in those moments that I wanted to cry, my tears came, but all I could do was smile from the inside with gratefulness, because I could focus on the legacy of my father instead of he left a void financially. He was such a big personality, but because he had things in order, our family is able to breathe with a little less strain, because we took the time to have those hard conversations and to get those plans in place. And there is something that is out there that can fit into everybody's budget. So you just have a realistic conversation. How much are you willing to invest every month? What are we looking at? Do we still have a mortgage on this house? Are we trying to educate the kids? What is the family plan? And then that way you'll be able to go forward with your decision making and your family planning with a professional. I'm available to talk, but I'm also connected to a huge network of other professionals that are able to connect you, whether or not, whatever your medical condition is or whatever your mental state is. We're able to connect you with professionals that can set your family up where that, like I said before, they don't have to mourn twice, once for your passing and then twice because they can't afford to be without you.
Yeah.
And I like that you brought up investing again, the same way Dr. Edwards did, investing in your health, investing in your mental health, and also investing in making sure that you don't have these added stressors at one of the most difficult times that anyone can possibly face. Because I think it all plays along into the fact that we have a hard time discussing our immortality. Our mortality, that we just don't want to have conversations around that, whether it's making sure you live longer or what you do after your life is after you're no longer here. Those are just hard conversations for us to have with our family members. So I think acknowledging that and having Kristen on the panel tonight to bring that up, as well as making sure that you're focused and having a primary care doctor, making sure you're dealing with your mental health. I think it all is in the same vein and it all goes together. It's all very important for us to make sure we're prioritizing our health in 2025 and beyond that.
And that's all great information. So I certainly appreciate that. And I do want to piggyback on something that Keisha said. I think that as caregivers or loved ones or whatever, like if we have someone that we care about and they're going through whatever, like we have to understand, like for example, if it's like something mental, we aren't therapists, we aren't licensed professionals, so we can't take on that role. And my family knows if they're going through something, they can call me anytime. I'm not going to say a word. I'm going to listen. I'm not going to offer advice. I'm not going to judge. I'm not going to say, well, you could have, should have done this. I listen to what they say. I empathize with them. If there's, if there's something I can share, I will. But I tell them because I had to do the same thing. Seek professional help. Go talk to somebody who is licensed, who can actually help you with what you're going through. Because that's really going to be the only way you're truly going to be able to cope. I know we have a lot of social media life coaches out there and all these other people who claim that they have all this knowledge and expertise, but you need to go see a professional, point blank, period. And Kristen, I want to ask you another question, and then Keisha and Dr. Edwards, if you want to chime in on that, feel free to. So for life insurance eligibility, right? Can pre-existing mental or physical health conditions influence your life insurance policy or your ability to get life insurance? Absolutely,
it can. So we always advise the earlier and the healthier you are, you're straight in there, and the older you are, the higher your risk is to be insured, because insurance companies, they look at the risk of you. Are you, what is your health? Are you an active, whatever your age is? Sometimes some different companies, they look at your gender, because women typically live longer than men. They look at your height, your weight ratio. That can be a factor. Your mental health can be a factor. Whether or not you've had DUIs can be a factor. Whether or not you have a criminal record can be a factor. Some insurance company even look at your credit, things of that sort. So every company has their own stipulations and requirements in the way that they do their underwriting. But for the most part, the majority of them will definitely look at your health as well, your physical health as well as your mental health. The higher your risk, the higher you can look at to pay for your premiums. The the more expensive it will be to get you covered, because of course, again, you're a high risk for the company. That's why we always say the sooner the better for you to go ahead and get insured. It's never too early for you to go ahead and get that plan put in place and locked in, either at a fixed rate, depending, because there are two types of insurance that you can get. Just it depends on your family's plan, your need, and what you're looking at. I particularly deal with the one particular kind, but I'm not going to force that on you if that's not what your family is looking to do. But I always make the recommendation that you would go ahead and get that plan as soon as possible. Definitely before you encounter any type of medical happenings or episodes and things of that sort. It's much easier to get you covered. Sometimes you can get covered like an instant. I've had clients where it only took like 30 seconds for them to get covered, and the company even offered them more insurance because they were in such great health. They were able to get more coverage for the same amount of money that they were originally quoted for. So it's definitely a factor. Your physical and your mental health are factors in being insurable, but everyone is insurable. I'll put it at that, but at different cost.
Right. So can I just jump in right there? So I remember one time when I was applying for life insurance, and they came out to my house and they did my height. I always lie about my height because I add a couple of extra half inch because I always say it's not that I'm too fat, it's just I'm too short. Because that affects your BMI. As soon as I stepped on that scale, I was like, okay. And so automatically, because our BMI is higher, even though I didn't have any problems with my blood pressure, no problems with my labs or kidneys or anything, because that BMI is high. And let's be honest, we live in the South where we have high BMI starting as children, starting as teenagers. I told you I'm obesity medicine. I see teenagers who come in trying to get their weight down. And so imagine you're trying to go get life insurance at 21 or 25 and you already have a BMI of 35. That's going to be that much harder. So making sure that we are doing things like managing, like you said, your mental health, your physical health, but do you know what your blood pressure is? Okay. And don't say, oh, it's just high today because, oh, it's 130 over 88. That's normal for me. No, honey, that's not normal for you. That's not normal. That's not normal for anyone. And if that is normal for you, then that's a problem. Let's take care of that. Let's do what we can do to get that better, because you're not going to get as good a coverage if you have problems that are, chronic. And the thing is, like I said, we live in the South, and so, but they don't care that everybody in the South most people in the South tend to be overweight or obese. Okay. They don't care. Or your family history of hypertension, or or you had gestational diabetes and it's kind of held over. So now you've got pre-diabetes. So these are the things that we need to be addressing earlier on, blood pressure, weight, those kind of things early, in order, not just for life insurance, but just for our health in general. But especially also, you're not going to get as good a coverage if you have problems like that. And so most people don't even know that they have high blood pressure. Do you know when's the last time you took your blood pressure?
Right.
Okay. When's the last time you checked your sugar? When's the last time you checked your A1C? Did you know that you were pre-diabetic? Did you know that your insulin levels were high? Okay. These are things that you need to be checking at your primary care doctor, at your wellness visits, but also that you need to be keeping an eye on your own. If you know that you got a little extra weight in your tummy, go ahead and address that now. We got medications now. Everybody's heard about all the weight loss medications that are not just for weight loss nowadays. We know that they're also now affecting our health. They're affecting our heart. By affecting, I mean improving our heart. They're decreasing your risk for stroke, decreasing your risk for liver failure and liver problems, and kidney disease. That's why you've got kidney specialists and heart specialists who are now prescribing the weight loss medications, because it's not just for your weight anymore. So these are the things that you need to be addressing earlier on by prioritizing and choosing you, because you're worth it.
Right. And also our companies look at that, because of course we have to pull your medical records and things of that sort. And if they see a pattern of, you putting in the work, that also makes you, that gives you a better chance at being insured, because it shows a history of improvement. So it lets the company know that you are intentional about your health and intentional about wanting to live longer. That state. Of course, even with your mental health, if you have certain mental illnesses or mental disorders, or you're on the spectrum for different things, it might put you on a higher risk, because maybe this person wants to get a policy because they plan on unaliving themselves. Truthfully speaking, during a certain amount of time, a company will not cover that. God forbid, if you just reach that point, that breaking point where you said, I'm just going to get out of here. I've got this plan in place to make sure my family is good. I'm just going to go ahead. But make sure that you are reading your policy. We don't want anybody to unalive themselves. We want them to get to run Nikisha, run to Dr. Nicole, run to, use those hotlines and all of those things, use those resources, because we don't want there to be any red tape in the end, for your family. But like you were saying, Dr. Edwards, that it's important that you are putting in that work, and you're going to see your primary care physician, because those notes that your doctors make on your report, they put you in a better position to be insured. Because in cases where people have been denied, they go back and get documentation from their doctors to say, hey, this person has been working, we're on a plan with this person, and then they are reconsidered for the coverage. They may come back as rated, maybe a little higher premium for the time being, but as they show improvement, we can put in for a reconsideration and have that premium adjusted, because you are putting in the work, and that, like we are all saying tonight, that you're worth it. You're worth putting in that work. So take care of those things early. It would be my recommendation.
Yeah. I mean, the only other thing I would add is, it totally makes sense. It comes down to level of risk, right? And if you have emotional, mental health issues that aren't being addressed, in most cases, though it's not going away, right? It's worsening, and the person is decomping. And so then they turn to other ways to self-medicate, which then again, it increased that risk, because now you may be drinking, or you may be using substances, or so it's all really kind of a ripple effect. So the sooner you realize that you need treatment, whether that be for emotional, mental health, and or physical, the better all around, because that level of risk is higher, which again totally makes sense in terms of resulting in you can still secure the insurance, but at a higher cost.
Definitely.
Because,
And again,
like
that was
said,
all great
anybody can
information.
get
So I really
insurance, but
appreciate
at
you
what
guys.
cost?
And we still have a few minutes left, right? So before we head out, I want to hear from each of you again. And I want you to give your final takes of just a lasting thought or thoughts that you want to leave the viewers with. Also, are there any resources that you can share about anything that we discussed tonight? Please feel free to go ahead and share those with the viewers as well. And we're going to go in the reverse order from the intro. So Kristen, we're going to start with you, sis.
Okay, cool. But once again, thank you guys so much, Shannon and Hook, for having me on tonight to have this very, very maybe uncomfortable for some people, but very important conversation about prioritizing your health, and not just your physical and mental health, but also your financial health. I would say that let this be the year that you stop putting those things off. Let this be the year that you say, well, I'm going to wait until I get this together, or I'm gonna wait for my next paycheck, or I'm gonna wait to do that. No, it's something that you need to do urgently. Put an urgency on taking care of the matters of taking care of your financial house, making sure you have that foundation of your financial house, which is to have the right kind of life insurance. Make sure that you are building and you have a financial plan for your family. If you have children, grandchildren, nieces or nephews, even if you don't have children of your own, anybody that you care about, or companies that you're affiliated with, charities and things of that sort. What do you want your legacy to be? Think about that. I just leave that question with you all. What would you like for your legacy to be, and what type of impact would you like to leave in the world after you have gone on? And what can you do today to ensure that your family has a great tomorrow?
Absolutely. All right. Keisha?
Love that. So just a couple of things. I will end with what I started with. And again, that's a quote, really kind of a mantra from one of the coaches in my fitness community. And that is choose your hard, right? And so taking care of your emotional, mental health, it can be a challenging first step for an individual to make. But it is so important. Your emotional health, your mental health, your physical health. We are not separate. Our minds are not separate from our bodies. Our feelings are not separate from our bodies. We are whole beings. And so we have to choose our hard. You can ignore the signs that are in front of you, the symptoms that you're experiencing. However, it's not sustainable over time for you to continue to function, particularly at your peak, if you're not having those issues addressed. And so choosing your hard is so, so important. A couple of things that I will just say really quickly. I always say to my clients, pay attention to, we've talked a lot tonight about your diet and nutrition, what you put in your body, what you consume does impact your emotions. It can definitely impact your emotional, your mental health, in addition to obviously having a physical impact. But pay attention to what you're putting in your body. Try to move your body, simply walking, just getting up. So many people now are buying walking pads. Movement does so much for our emotional and our physical health. Sleep is so important. Sleep. Managing stress, also so important. Such a significant impact on both our emotional and mental health. Also, staying consistent with preventative care is extremely important. Surround yourself with positivity, healthy environments that help nurture you and where you're trying to go. And then last but not least, seek professional help if you need it. TikTok is not professional help. IG, watching coaches.
Say it again, Keisha. Say it again.
Professional help. Reach out. 988 is a crisis line number, but there's also trying to remember the Psychology Today. I'm listed on Psychology Today with so many other hundreds, perhaps even thousands of therapists who may accept insurance if you need to use your insurance, and you can search by state. So whatever you do, seek a professional. You owe it to yourself. Be kind to yourself.
Yeah, I'm still working on that sleep part, but I'll do better in 25.
Absolutely, it's so
All
important.
right, Dr. Edwards, what you got?
All right. Well, I think the ladies have already pretty much summed it up. But thanks, guys, again for having me. I would say again, for everyone, choose you. You are worth it, and you've got to invest in yourself. Invest because you're worth it. You're worth it. And so, doing things like Keisha just suggested, eating a healthy diet, exercising, drinking plenty of water, getting plenty of sleep, going to see your doctor. Avoiding, lots of people say, "Oh, I'm choosing my peace." So I'm avoiding things that cause me stress, right? Because all of these things affect our heart, affects our lungs, affects our sleep, affects our weight, affects our blood pressure. And so understanding and get the education again from the right place. Now I'm on TikTok, I'm on all the social medias, but I always say as a disclaimer that this is not medical advice, all right? This is for social media. You need to come and see me as a patient if you need to get some actual advice. But get the education. Understand that education is key. And so when we know better, we do better. And that's what I want for all of my patients and all of you all, is to do better and to choose yourself in 2025. Choose you. Choose wellness. Choose you're worth it. You're worth it. Self-care is not selfish. And again, caring for yourself means coming to the doctor, going and getting, choose you. That's all I'm going to say. Choose you.
Absolutely. Shannon, what you got?
I didn't know I was going to get a new mantra for the year from this podcast, but choose you, you're worth it. That's my saying for 2025. You're worth choosing your health, you're worth choosing your mental health, and you're worth choosing your financial health. And I was reflecting on, even with the whole, just prioritizing your health. I didn't do that very well in my 20s. I've been working on it more in my 40s, but it also led me, as I was trying to get life insurance, to realize I need to have conversations with my children who are in their 20s about taking better care of themselves, not ignoring things that they notice with their bodies, and then go ahead and getting life insurance in your 20s. It's so much easier, so much less cumbersome to do. So I just thank you guys for coming here today and sharing your knowledge and sharing what you do for your professional lives, and also sharing your personal stories with us. I just really appreciate it. And everyone would just remember, choose you. You are worth it. It is 2025. It is our time to prioritize the things that give us our best lives.
I love
And
that.
I don't have a lot to add. This is a panel full of phenomenal Black women. So I'm very appreciative of you guys. And having been raised by Black women, I was always taught that when Black women speak, just shut up and listen, because you may just learn something. So I won't regurgitate what you guys just said. But I will that choose you 2025 is going to stick with me for a while now. And I think, like Dr. Edwards said, it's okay to be selfish in any aspect. Sometimes you have, and I wish that's something I would have learned early on. I learned that later in life, but I'm glad I learned it. Because it's okay to be selfish at times. It's okay to choose you. It's okay to make yourself the priority. And sometimes you have to do that in life, whether that's physically, mentally, or financially. Health is wealth, and health definitely matters. So again, ladies, thank you guys so much for joining us. We certainly learned a lot. And hopefully you guys would join us again should we reach out, because I certainly appreciate everything that you guys mentioned. So Dr. Edwards, thank you. Keisha, I appreciate you. Kristen, thank you for your knowledge as well. And Shannon, as always, I appreciate you, sis. I love you.
Well, if there's a way that we want to get in touch with Kristen to like get insurance, or with
Sure.
Keisha, where are we putting all of our information so that folks can get in contact with us?
Yes, thank you, Dr. Edwards. Thank you.
I'm just saying, I'm choosing me.
Yes.
And choosing y'all too.
Please shout out how people can get in touch with each and every one of you. Please shout that out.
Sure. I can be reached. You can leave a message with your telephone number and your email address. You can give me a call directly on my line at 803-997-0793. I can put that in the chat box. You guys can reach out to me via social media. If I'm not able to help you, trust me, I am connected to a very, very large network of professionals who are able to meet the exact need for your family. And I promise you, some people don't like to talk about insurance because they say it's expensive. Oh, that's too expensive to get. Well, would you rather pay maybe $80 a month, or do you want your family to try to get $20,000 in a week?
That part.
Choose your heart. Like you said, choose your heart. So reach out to me. You can do so via just type in my name, Kristen Jameson, on any of the social medias. Hit me up. Hey, Kristen, I saw you talking about life insurance. I don't know where to start. Point me in the right direction, and then we can have the conversation from there. The whole process takes about maybe 20 to 30 minutes. Awesome. And I can save your family for just having a fish fry.
Good deal.
Or, GoFundMe is for crowdfunding of dreams, not a crowdfunding to pay for your service.
Exactly.
Taking responsibility of that for your family.
That's right. I'm at KeishaGinn@gmail.com. My website is www.keishaginn.com. And phone numbers 980-776-6780.
All right, and I'm Dr. Nicole. I have multiple websites and multiple social medias, but you can find me at Dr. Nicole D.O. So DrNicoleDO. I'm a doctor of osteopathy. And from there, you can find my website, you can find my social medias, or you can call my office, which is Abundant Life Concierge, at 803-995-7206. But if you go to drnicoledo.com, you can find links to get to my practice and all of my other sites from there.
Good stuff.
That's awesome, man. And again, for the viewers watching, if you guys missed any of this, please go back and watch the playback. There's a lot of useful information. If you have friends, family, loved ones who missed the podcast, share it so that they can get this information as well. And again, thank you guys so much for your participation and all your expertise. And choose you 2025. That's what we'll end on, man. So again, this was great. And again, thank you guys for coming. Shannon, I appreciate you. And until next